Hey guys, Dr. Jordan here at Sports Chiropractic of Utah. We have a very, very special video for you today. This is Kelsey. Kelsey is a patient of ours and she has agreed to do this video. We're talking about the shoulder, and today I want Kelsey to kind of introduce to you guys what was going on with her shoulder and what kind of results we had, because it was pretty cool. Like over the past, gosh, what has it been, 2 months now, 3 months? We've been working with her, trying to get her shoulder pain to go away. So take it away. Tell us a little bit about what the heck was going on.
So I guess pre-accident, I had a lot of tightness in my shoulder. Got in a car accident, which really triggered my shoulder into kind of full force set of pain. And I actually saw a physical therapist directly after the accident. Was seeing him. Didn't get much success from it, so I kind of chalked it up to a lost cause and suffered through it. I couldn't sleep on my side. I couldn't compete the way that I usually compete. And so it wasn't until one day I woke up and I could not get out of bed that really motivated me to come seek professional help. So came here, and it's been a slow but definitely much progress. I have nearly no pain in my shoulder now, and I can sleep on it, which is the biggest thing to come from all of this. So truly amazing.
Awesome. Well, thank you. We did not pay her to say that. Not yet, anyway. But anyway, so we're going to demonstrate today what we did for Kelsey, and let's just take her through the treatment. So let's go ahead and start face down for me, and I will just run my mouth like I normally do. So with any shoulder case, like we've been talking throughout the month, it's very important to have the mid-back moving really well. So what we're going to do is check which areas we're going to focus on. There's a little bit of tightness right there, isn't it? Normal. She's also a student. I won't tell you where. She's a student and does have to sit for a few hours a day. So we're going to get her mid-back moving a little bit better. So big breath in for me. Good. All the way out. Good. A little bit of pressure here. Very good. One more. Very good. Got it. And then before, we're going to check one specific muscle, the lat. Her lat was just, so the latissimus dorsi for all of you anatomy nerds out there like me. And Kelsey, actually, she's an anatomy nerd too, right? You like anatomy. So her muscle down here, the lat muscle, which also helps in keeping her shoulder down with movements, was not working very well. So what we did, we found some fun spots in here initially. So we're going to work through that, kind of demonstrate an active release of this upper lat muscle, which is still, you can probably feel that right there, it's still a little tight. So let's do your cup of water motion. So I have patients pretend like they're holding a cup of water. Go ahead and reach all the way forward and all the way down. What this does, it just actively releases the lat muscle. We'll do that a couple more times here. How's your pain level with this today?
It's fine.
Woohoo! Before she wanted to kill me.
Yeah.
I do remember the first time we did that. She wouldn't let me do it.
Yeah.
So we've also, you guys have seen also, we've done cupping before. I did cupping on my favorite patient, no offense, but it was my wife.
Oh, that's okay.
But, so we did a lot of cupping through this area too, which also caused quite a bit of pain, right? In the very beginning anyway.
Yeah.
One specific spot.
Yeah.
Okay, let's go ahead and bring your arm up here for me. Go ahead and push into my arm. Good. What we're doing now is we're just trying to help keep that lat turned on. Okay, relax. Again, we're activating it by having her push down, kind of simulating a pull-up motion. Good. Last one here. Go ahead. Good. What I'm feeling for down here is making sure that muscle is nice and tight. Okay, very good. Okay, let's go ahead and have you flip over on your back for me, please. Now we're going to take care of her neck, because as we've talked about throughout the month, the shoulder's not just the joint itself. It's consistent of both our neck, our mid-back, and all of those areas. So we want to make sure the neck is functioning well. Good. A couple little spots right here. If you don't mind, also we found something. We found one specific muscle that was causing her pain. For how long were you experiencing this pain?
My whole life. Well, from teenage on.
From teenage on. So a whole life.
My memory these days only goes back so far.
Yeah, right. The life before the teenage years is just non-existent, right? So we're going to get her neck moving a little bit better. So she had, very good. She had a pain that was causing kind of upper chest pain for, gosh, at least from what I remember, about 10 years you were experiencing this. Is that about right?
Yeah.
And just constantly, just kind of like this weird thing. Where other providers told you it was what?
Like
Was it a broken rib? I can't even remember what.
Yeah. Or like a ligament tear.
Yeah, that's right. Yeah,
in the rib area.
Uh-huh.
Yeah.
Yeah. So.
And it was non-operable, so it was a lost cause.
Right. They didn't really care, right? Very good. Good movement there. So anyway, we found one specific muscle right here on her left side. It's the scalene muscle that helps with breathing. And that muscle had a very prominent trigger point right down into here. We started working that out. And where has your pain with that been as of the past month or so?
I forget.
Which
is cool.
Yeah, that's good.
Yeah.
So we're able to finally identify exactly what the heck was going on, get that taken care of, and now her chest pain is next to nothing.
Forgettable.
Yeah, which is awesome. So we're just doing a little bit of active release through some of these muscles in her neck, and then we're going to sit her up, adjust her shoulder, do a couple more movements for active release, and get her on her way. So we're very, very excited for the relief that you've experienced over the last couple months. Okay, let's go ahead and sit you up for me. Go ahead and face the door. Okay, I'm going to demonstrate our shoulder adjustment. It just kind of helps reset the shoulder. So go ahead and put your hand on your hip, fingers pointing down. Good, go ahead and kick back against. Oh, that was easy. Nice little click right through there. And the last thing we'll do, you guys have seen this before, demonstrated on Megan. Right, Megan? Mm-hmm. But we're going to do a little bit of active release through the rotator cuff muscle as well. So go ahead and do your seatbelt motions for me. We're going to do about 3 or 4 of those. Good. Right through here. Excellent. Good. And one more after this. Perfect. Okay. Very good. How does that feel?
Fine. It's crazy.
Woo-hoo! Thank you guys for tuning in, and thank you, Kelsey, for being our first ever treatment that we've demonstrated on camera. If you guys have any questions or know of anybody dealing with a shoulder problem, please tag them in this video. We'd be happy to take care of them. So thanks for tuning in, guys. We'll see you next time.